So I first came across the STAK tool at a conference. I see a lot of patients with stiff knees for all sorts of reasons. And I was looking for something that was going to help enhance the physiotherapy that we could offer them, and particularly something that they could go away and do and work on in between our sessions. So something that could give them a real consistent approach to physio, something that would give them some real feedback, and something that gave them a sense of purpose and achievement that they could go and do themselves. And what was really great about it was they could go away and do these things. They could use the STAK tool, they could develop some range, and then when they came into clinic, we could build on that really nicely. So we could build some strength in this new range. We could adjust the program that they were using, the way that they were using the STAK tool, and being able to measure before and after each session each week was a really nice way of creating some feedback, some visual feedback that patients could use and they could take, and to really spur them on and motivate them.
So can you bring those hips forward a little bit for me? That's it, well done. And this is really important to break down that scar tissue.
Okay.
Really well done.
There's such a huge range of stiff knee patients. So we have a lot of patients who are after a total knee replacement. They develop this arthrofibrosis post-op, and we can see them from as little as 4 or 6 weeks post-op, really up to 2 or 3 years post-op. And they have real challenges with their mobility.
Bit of a stretch. I'm just trying to stretch that knee out, just like that. Okay, well done. We'll relax it a minute.
Yeah.
Down there, well done. And then we're going to do that again.
Okay.
All right.
Things like just walking can be really uncomfortable. They can be very slow. Getting up and down stairs is always something that people struggle with. Often people struggle to do things that were meaningful to them before the op or before their knee became very stiff. So things like playing golf, things like going and cycling. People often describe having to park a long way from their destination so that they can open the door wide enough to get out. And that can be really challenging.
Again, so big stretch, big stretch, big stretch.
A little bit of
good, 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 good.
So some of the challenges we faced before the STAK tool, patients, you could work on a patient really hard in a session and you could do all of your manual therapy and all of your exercise, and there might be an improvement, but by the time they get back a week later, a fortnight later, a month later, it's all gone. And patients, they don't have, without the STAK tool, something to go away and do at home that they can really work on and enhance their range of motion, because breaking down the arthrofibrosis is something that needs to happen every day. It's something they have to keep working on. Otherwise, it just resets. Otherwise, it goes back to how it was. And that can be really, really frustrating. Whereas using the STAK tool, it allows them to go away and do that every single day. A patient that stands out to me is one of the first patients I treated with the STAK tool, and it was an older lady who was 18 months post total knee replacement, and she had really quite poor range of motion at the time. I think it was about 75, 76 degrees before she started with us. By the end of that treatment cycle, she was able to achieve 115 degrees. It was a big, big change. And she got back on a bike and take her first few revolutions, and that was brilliant, a real motivator for her. And by the end of the session, she was on a bike, cycling outside, doing all of those things that she liked to do again, which was brilliant.
Let's get on this bike then.
Right.
Lovely, right. Pop those feet in those pedals.
Okay.
And let's have a go at turning it.
Okay.
Let's see. Oh, fantastic, well done.
So I think the role that the physio can bring to the STAK program, it depends a little bit on the patient, and it can be a whole range of things. So the first thing is about delivering the STAK tool. So we have a program that we have to set up and deliver and teach them to use this tool. And then we can start to develop that program and tailor that program for the individual.
Yeah.
Okay, so 2 hands onto this armrest for me. Really pull yourself across, bring that hip down to the chair, all the way down. Good, good, well done. And a little shuffle forward if you can. Let's create a bit of space. Perfect, well done. So we're gonna hold this for 20 seconds, really good.
It might be that they struggle with pain and motivation, or it might be that they really struggle with just developing that stretch. And we can do all sorts of things around that program. So we can add in things like manual therapy, soft tissue massage. We can add in an exercise program to complement the STAK tool. And we can be there for the patient. We can answer those difficult questions they have about why this has happened to them and what we're going to do about it. We have to be able to break down that scar tissue that's stopping you from bending that knee. And so we need to be able to push through that pain. All right. So we've got a letter here that we can take to your GP. So the STAK tool is brilliant for patients, but it's also great for the physio, and it really opens opportunities to explore our role across all 4 pillars of practice. So it's a great addition to our clinical practice. It's really easy to integrate, but it's also an opportunity to educate patients and colleagues. It's an opportunity to lead and develop the program and tailor that program. And there's a great opportunity to be involved in the research side of things. We can do audits, we can do service improvement projects. It's looking at the STAK and how it impacts patients and all the benefits that it can have. I would be so encouraging for a physio to get the STAK tool. I think it has such an impact on the patient. It's such an easy thing to use. It makes such a difference in a patient's life. It gives them something to go away and to do, to focus, to motivate. It's such an enhancer of what you can offer as a physio in clinic, and it opens up so many opportunities across the pillars of practice for you to progress personally.
Thank you so much for your support and guidance. I would never have been able to get my foot back to 115. It was just incredible, but you've made it all the difference to my life. I can move now.
It's a really rewarding treatment for physios to deliver, and I hear this feedback all the time. These patients, they're desperate for an improvement and a recovery. Patients will buy into this early because they get that immediate improvement. The initial scar tissue is not as dense, so they get an improvement quite quickly. But then they really need that support along the way because it's a hard 8-week program, and the patients really value your physiotherapy input, adjusting the regime, and the great rapport you build with your patient.